We are going to take a look at the behind the scenes today for the organization. So this would be for admin and how you set things up so that way your team is working efficiently. This is obviously my test site, but first of all, let's look at settings on here. So admin will be able to go ahead and rename whatever the organization name is, select the service types, their address, all of your organizational information, EIN taxonomy, billing taxonomy, and the general place of service types that your organization works. You can also do the calendar year in case you are an organization that runs on a calendar year or an academic year. Also, districts and schools, that would be for organizations that contract out with districts and or schools, or also for school-based therapy teams that actually need to see their caseload by this districts and or schools. For my therapy organization, we do some contracting with charter schools, but we also contract out with specific districts or programs. So the way I do that in my real one is I would call a district the name of a contract, and then I would name the school so that way we can be able to track, how many are on caseload at those specific districts or contracts or schools. Templates, this would be where you could go in, first of all, for assessments, for standardized assessments. That's the assessment library that are kind of the favorite for your team. Of course, when we'll be adding on the speech, PT, and mental health assessments. Right now, what you'll see are more OT related. Questionnaires. So we need questionnaires that you want your team to use. The service template. So that would be for guided evaluations. If you have specific ones that you want your team to use, then you can choose any of those. Again, this is some of the OT related ones. So if I chose that one because maybe we have preschoolers, these will always show up as favorited. Report types means that once your team has done a guided evaluation, how do you want their evaluation report to be written? So anyway, these are the top ones that I have. So that all of these things will kind of feed into other logic to make it easier for your team to be efficient. Permissions across here will basically say, when you assign your therapist, you have an option to do a primary, secondary, or a tertiary therapist. And each of these you will assign like what their permissions are. So these are role-based permissions. Billing on here would just kind of tell you how many seats that you have purchased, how many you've used. You can manage your subscription. You can purchase more AI credits if you need to. You can also see report usage here. And then the medical part this is on any patient-facing branding, how you want it displayed, any payment terms or instructions would go here. You could add in any organizational holidays that you wanted to. And then if you are part of the billing plan, you would be able to put in your API key so that way you can integrate directly with Claim API or Claim MD. So that is a quick look at the organizational settings.